Video, we're going to be taking a look at our mobility through the middle part of our back, which is where our ribs attach to and is commonly referred to as our thoracic spine. So this can be a very vital component to our mobility and our flexibility and our ability to be able to do especially pressing movements where we're using just one side from there. If we look at rotation, we're both sides whenever we're doing extension. So I like to utilize a foam roller to ensure that we're checking the motion specifically in the middle part of the back and that we're not compensating or cheating too much using our lower back in order to make up for a lack of motion or mobility through the mid back. So I'll usually place that foam roller in between the knees and have my feet set on a firm surface down below me if I'm sitting. And then I'm going to cross my arms up and over my shoulders on the opposite side. And to assess my ability to rotate, I'm going to go ahead and turn through the middle part of my back and my torso. I'm going to rotate to the left, hold for a couple seconds, and then I'm going to rotate back to the right and hold for a couple seconds in that position. If I can get some visual input, I'll do it in front of a mirror too as well, or videotape myself so that I can see any differences or discrepancies right versus left side. Now that assesses rotation, but we also want to take a look at side bending. And so in that case, I'll bring my hands up and behind my head, still sitting in the same position and keeping pressure into the foam roller. I'm going to go ahead and bring my elbow down towards my hip on the same side, bending through the middle part of my back, holding for a couple seconds. And then I'm going to bend back over in the left side, again assessing for any differences right versus left there. Good. And then finally, I'm going to show from a side view what we call extension, which again is going to be very helpful in our overhead pressing movements, especially when we're pressing with both sides, so that we're not compensating in order to get up into that position by doing things like using our lower back or using our neck to make up for a limitation in movement through our mid back. So in this position, to look at extension, again, I'll bring my hands up and behind my head. I'll pinch and keep pressure into the foam roll, and then I'm going to try and move through my mid back and arch back into that position and assess and make sure I can get all the way back.